Greetings everyone, welcome back to Brainetainment, your one-stop spot for insightful and engaging content. Today we're delving into an essential topic, foods to avoid after teeth extraction. Your diet post-dental procedures plays a pivotal role in your recovery. Ignoring your dentist's dietary advice can lead to complications, slowing down your healing process. So it's crucial that we understand what foods could potentially hinder our journey to a swift recovery. Without further ado, let's dive into the types of foods you should steer clear of after teeth extraction. First on our list, hard foods. Now you might wonder why. Well, let me enlighten you. Hard foods are not your friend after a tooth extraction. Picture this, you're basking in the glory of a freshly popped bag of popcorn, or perhaps you've just unwrapped a delightful hard candy. But before you take that first crunch or suck, stop and think. These foods may seem harmless, but they can wreak havoc on a healing mouth. Nuts, candies, popcorn, or any hard food can be quite the menace to an extraction site. When you bite down on these foods, the pressure can dislodge the blood clot that forms post-extraction. This clot is crucial in the healing process, acting as a protective layer over the exposed bone and nerves. Moreover, hard particles from these foods can get stuck in the extraction site, causing discomfort and pain. What's more, they can even lead to infections if not properly cleaned out. Hard foods require more effort to chew, which puts unnecessary strain on the extraction site, thereby slowing down the healing process. Therefore, it's not just about the immediate discomfort, it's also about the potential complications that could delay your recovery. The goal post-tooth extraction is to heal swiftly and comfortably, and hard foods just don't play well into this plan. So remember, it's best to avoid hard foods until your mouth has fully healed. Next up, we have spicy foods. Quite a bummer for the spice lovers among us, right? Now, we all know that a dash of spice can elevate any dish, adding that extra kick we sometimes crave. But when it comes to post-teeth extraction care, it's best to hold off on the hot stuff for a bit. Think about it this way, your mouth is in a state of healing after a tooth extraction. It's more sensitive than usual, and introducing spicy foods to the mix, well, it's like poking at a wound. The capsaicin in spicy foods, which gives them their heat, can cause irritation and inflammation at the extraction site. This is not what you want when your oral cavity is trying to recover. The last thing you need is an inflamed socket, which can delay the healing process and potentially lead to complications. There's also the discomfort factor to consider. The intense burning sensation from spicy foods that some of us love can feel considerably more intense when you're dealing with a fresh extraction site. Imagine that fiery feeling amplified and lingering around the sensitive area. Not a pleasant picture, is it? So even if you're a self-proclaimed spice king or queen, it's worth putting your crown away for a while. Allow your mouth to heal first. Then you can gradually reintroduce spicy foods back into your diet. In short, keep the spice levels down, at least for a while after your teeth extraction. Moving on, we have alcoholic beverages. Yes, that includes your favorite weekend wine. A common misconception is that alcohol, being a disinfectant, may actually aid in the healing process after a tooth extraction. However, this couldn't be further from the truth. Alcohol, in fact, can interfere with the healing process in a number of ways. Firstly, alcohol has a drying effect on the mouth. This dryness can impede the formation of a stable blood clot at the extraction site, which is crucial for the healing process to begin. A stable clot acts as a protective layer, allowing new tissue to form underneath and heal the wound. By causing dryness, alcohol can disrupt this process and delay healing. Secondly, alcohol can interact with the medications prescribed by your dentist. Many painkillers and antibiotics, common post-extraction prescriptions, can have their effectiveness reduced when mixed with alcohol. This could potentially leave you in discomfort and prolong the recovery period. Lastly, alcohol can lead to inflammation and swelling, aggravating the extraction site and causing unnecessary pain. It's also worth noting that alcoholic beverages, particularly wines and beers, often contain sugars which can promote bacterial growth and potentially lead to infection. In conclusion, while a glass of wine or a pint of beer might seem like a good idea to take the edge off post-extraction, the potential risks far outweigh the temporary relief. So hold off on the celebrations until your mouth is back to its normal self. Now let's talk about hot foods and drinks. When we say hot, we're referring to temperature, not spiciness. After a tooth extraction, your mouth is in a delicate state, and subjecting it to extreme temperatures can cause discomfort. Imagine this: you've just had a tooth pulled, your mouth is already sensitive, and then you introduce a piping hot substance. Not the most pleasant feeling, is it? But it's not just about discomfort. Consuming hot foods and drinks can potentially interfere with the healing process. When a tooth is extracted, a blood clot forms at the extraction site. This clot serves as a protective layer, covering the underlying bone and nerve endings in the empty tooth socket, and assists in healing. Introducing hot substances to your mouth after extraction can dislodge this crucial blood clot. This can expose the bone and nerves, leading to a painful condition known as a dry socket. Dry socket is not only uncomfortable, but also delays the healing process. So you see, that steaming cup of coffee or hot bowl of soup is not worth the risk. The key here is moderation. You don't have to consume your food or drinks at room temperature, but it's important not to have them too hot. So it's wise to wait until your coffee or soup has cooled down a bit before consuming. Last but not least, sticky and chewy foods. This category could be a tricky one, as it includes a range of foods that are often favorites. We're talking about gum, caramel, and even certain types of bread. Let's start with gum. It's something you might reach for out of habit, to freshen your breath, or even to help you concentrate. But after a tooth extraction, this seemingly harmless habit can cause quite a bit of trouble. The gum can stick to the extraction site, causing discomfort as you try to remove it and potentially dislodging the clot that's formed to aid in healing. Next up, we have caramel. This sweet treat is known for its stickiness. While this is usually part of its appeal, following a tooth extraction, it's the last thing you want. The stickiness can adhere to the extraction site, leading to discomfort and possibly even damage. And then we have certain types of bread. Some bread, particularly fresh bread, can be quite sticky and chewy. If pieces of these foods get lodged in the extraction site, it can cause discomfort and potentially lead to an infection. In all these instances, the problem arises from the food sticking to the extraction site and causing discomfort or potential damage. So, while these foods are generally enjoyable after a tooth extraction, they're best avoided until you're completely healed. Conclusively, it's best to avoid sticky and chewy foods until you're completely healed. To wrap it up, your diet after teeth extraction plays a crucial role in your recovery. It's vital to remember that what you eat or drink can either speed up your healing process or lead to complications. We've taken you through a journey of understanding the types of foods that you should steer clear from after a dental extraction. Let's take a quick recap. Hard foods are a no-go zone. They risk dislodging the blood clot that forms after extraction, a crucial step in the healing process. Foods like nuts, popcorn, and raw vegetables should be avoided until you're fully healed. Spicy foods are another category to avoid, as they can cause discomfort and even lead to inflammation in the extraction site. So it might be a good idea to hold off on that spicy curry or hot salsa until your mouth has healed. We also discussed the need to steer clear from alcoholic beverages. Alcohol can dry out your mouth and interfere with the healing process. It's best to hydrate with water or non-alcoholic, non-carbonated drinks instead. Hot foods and drinks are another hazard post-teeth extraction. A hot cup of tea or a bowl of soup may sound comforting, but the high temperature can disrupt the healing process. It's advisable to stick to lukewarm or cold foods and beverages. Lastly, we cautioned against sticky and chewy foods. These can get stuck in the extraction site and cause discomfort or infection. Foods like gum, candy, and certain types of bread should be avoided. Remember, these guidelines are not meant to limit you, but to aid in your recovery. It's always crucial to follow your dentist's advice regarding your diet post-extraction. After all, a healthy recovery means a quicker return to your regular diet and a bright, pain-free smile. Thank you for joining us today at Braintainment. Don't forget to subscribe for more enlightening content. Take care of your smile and it will take care of you.